So tell me, where are you from?
Fairview, North Carolina. Well, I'm here because of jaw pain, specifically on my right side.
Yeah.
And achy teeth on this side as well. And I've been, for the past a year and a half, trying to fight through an issue of burning tongue.
Yeah.
And I've noticed I'm getting a little relief from changing from a splint to a full mouth guard.
Yeah.
And I thought, well, if that's given me that much relief, then maybe by completely correcting this,
If it's a bite issue.
if it's a bite issue, then it should continue to correct it and hopefully get rid of the burning mouth.
So about a year and a half.
Year and a half now, yeah.
Before then, no problems?
No problems.
No issues?
No issues.
You're chewing fine, no pain?
Yep. And specifically a root canal tooth, which I didn't think I'd ever have any pain in, but still I get pain on actually the 2 root canal teeth.
Yeah.
And
No, I'm not discounting that. I believe you.
yeah.
What did your other dentists say? Or dentists? Did you see multiple?
I've seen multiple dentists, and they can't seem to figure out why I would still have pain on
A root canal treated tooth?
a root canal treated tooth, and I can't even tell you what their reasonings were because they just didn't have any answers. You know, I mean.
Okay. Do you get headaches?
Yes.
Where at?
Here,
Right side mostly?
always on the right side.
Okay.
Right in front of my ear, right
Okay.
here, I get all this in here,
Right?
back here.
Your traps, yeah.
And I get a little sort of in deep into my shoulder here.
Right. What helps? Do you take meds for that, or?
Yeah, I take over-the-counter Excedrin.
Yeah.
I don't have to take a lot, which is good. It seems to help.
Yeah.
I see a massage therapist who specializes in oral facial pain,
Sure.
and that seems to help. I've had acupuncture.
Yeah.
That seems to help. But it's all temporary because then you go to bed or after a couple nights and it's back again.
Are your teeth sensitive?
Yes.
Is that a new thing?
Not necessarily. It's been on for, I think that's why the root canals were done in the first place, because it was just a sore tooth that no one could figure out. So
they threw the bullet at it.
yeah, they just said, here, we'll give you a root canal. And it
Yeah,
won't
let's
hurt
see if
anymore.
that works.
Yeah.
Rake to one side and open. Beautiful. That was your right. See, you don't get off your back teeth fast enough. Well, it's not terrible, but your spastic is happening right there. So that's not real healthy. You're contacting harder on your right side. But you see, we've ruled out that the joint is soft tissue and hard tissue seems pretty healthy, so that's probably bite related, okay?
Mhm.
That's the point of scanning. So now we can do our thing. Yeah, you don't ever properly get off your back when you're right. Yeah, so is disclusion times infinite going right? Going left, it's 0.21. All right, let's get to work.
Well, yeah, I don't have pain in the, right now, the 2 teeth that were bothering me over here on the right side.
Ice water. 0 to 10.
That's about a 5.
It's less than it was.
Yeah, yeah.
Like for sure, right?
Oh, yeah, yeah. I mean,
And it's the friction, the excess friction on that tooth that still remains that's making it hypersensitive. Like they are, could very well be due to a little disc issue that you've got, which we know you've got a little one.
yeah.
But we've ruled out that the disc isn't like destroyed and gone.
Mm-hmm.
So see, if I didn't have an MRI on you, I'd be wondering, oh God, oh God, oh God, what's going on with him back there?
Yeah.
Because if the disc has a thickness between your skull and your jawbone. It's about 2 millimeters thick. You know, and it's a long thing. It's like a bow tie shaped thing. My point is, if you take out, let's say it's squeezed out slightly, take a millimeter of it away, the whole jaw goes up and the back teeth pivot off one another and they bang too hard, just like that data shows. See what I'm saying?
Yeah, yeah.
So that can affect the bite directly.
Feel it.
You were feeling it. Now
Yeah,
you're
oh,
not
yeah.
feeling it.
Yeah.
Right?
Mm-hmm.
Good.
No, but this would be the area that would feel
Tight?
tense, tight, and this feels pretty good. I don't feel maybe right in there a little bit still, but I have a funny feeling it's going to be a little bit of residual until it calms down, I would suspect.
Oh, yeah, for sure.
Yeah. But, yeah, everything feels good so far. Yeah.
Did you have any issues back here?
Yeah, right underneath my right side, underneath my skull, right?
Occipital, right there?
Yeah, right in there.
Is it still there?
No, but that feels good. Keep going.
Smart Alec. Okay, now look, this stuff back here is
Uh-huh.
mostly, especially if it's midline. If it's midline, it's almost always cervical.
No, it's off to this side.
If it's off to the side,
yeah,
it can
right
be
there.
cervical or it can be TM.
Yeah,
They both bleed into one another.
yeah.
So you've got a back circuit and you've got a front circuit neurologically, and the goal is to get off of your back circuit in a quick amount of time. And when you don't, that's when the muscle gets pissed.
We're coming together just after my back teeth, these few teeth on this side. It was
Yeah.
like boom, boom, just boom, back, front. And the left never touched, it seemed like.
Yeah. So now, you know, this took us about an hour, a little over. So now, compared to when you walked in, give me a, you know, compare and contrast, if you would.
Well, I can feel, obviously, I've got, what are they called, canines. I mean, I feel like I actually have teeth there now.
Yeah.
And it sort of keeps everything in a line.
Yeah.
And it makes it actually harder to move it to the left and the right. Before, I could just go back and forth really easy. But now there's something there keeping that from happening, which is...
Well, it's you've given yourself a bite. See, you bit there on your own. I just built you into where you wanted to go.
Yeah.
So now, when you do chew around, you're going to ramp off of these guys, and the muscles don't have to work so hard. That gives them a chance to heal. When you walked in, your main thing was your right side.
Mm-hmm.
And now,
Well, I don't have
You
any
don't
issue
feel
on the
it.
right side, yeah.
yeah. But this morning you did.
Oh, yeah. Oh, yeah.
Yeah.
Yeah, I mean, all the muscles up here have calmed down above my ear,
Yeah.
as well as I had that, like, that distinct pain just in front of my ear.
Yeah.
That's gone. Yeah, I don't feel anything.